If you're considering having decompression therapy for your spine, make sure to watch this video to save yourself a bunch of time and money. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what spinal decompression therapy is, the difference between surgical and non-surgical spinal decompression therapy, is spinal decompression therapy even effective, and how you can do spinal decompression on yourself from home. Now, first of all, what exactly is spinal decompression therapy? Well, what typically goes under that term of spinal decompression therapy is essentially traction, where you go to a chiropractor or sometimes a physical therapist's office and they put you on a table where they strap you in up here, strap you in down there, and then stretch you apart in what looks like a medieval torture device. In fact, a lot of times when I worked in clinics that had those type of tables, patients would even joke that, hey, that looks like you're going to strap me into the rack. So how is it actually supposed to work? Well, when you take that pressure off and you stretch the spine, it's supposed to relieve pressure off of the discs and help centralize a herniation. But research has shown that that doesn't actually really happen. So how is spinal decompression therapy different from surgical spinal decompression? Well, surgical decompression involves taking anatomical pressure off of the spinal cord. It's usually used in people who have radiating pain, numbness, or weakness down in their legs, or bowel and bladder problems where they're losing control of those functions. And in surgical decompression, they actually cut off a piece of the bone. It's like removing the lid off of the spine. And that helps create more space for the spine so that the spinal cord isn't being compressed. Sometimes it's also done by cutting out a little piece of the disc that may be putting extra pressure on the spinal cord. And so that's an anatomical decompression, usually of compression around the spinal cord this way, where the spinal canal is not wide enough for the spinal cord without putting pressure on it. Conversely, what's considered non-surgical spinal decompression therapy or traction therapy is a longitudinal stretching of the spine. So they're very different in concept, but it's been very well marketed under that term because it's used as an alternative to surgery, which most people want to avoid because there are a lot of risks with surgical spinal decompression, including death, injuring some nerve during the surgical procedure, or just spending a lot of money and it not working. So it's been very well marketed, and I don't usually read research in my videos because it's boring and nobody wants to hear it. But there's an article that I found, it's back from 2007, so it's a little bit old, but it was actually in the Journal of Chiropractic and Osteopathic. And it's called Non-Surgical Spinal Decompression Therapy. Does scientific literature support efficacy claims made in advertising media? And essentially they say traction therapy has been utilized for decades in treating lower back pain. It costs over $100,000 for clinics to buy these, and usually it costs the patient as a trickle-down effect several $1,000s if you're paying for it out of pocket. And it says this form of therapy has been heavily marketed to manual therapy professionals and subsequently to consumers. But then they go to say they want to compare the research evidence to see if it actually lives up to those marketing claims. Now, long story short, it didn't. Their conclusion was only limited evidence is available to warrant routine use of non-surgical spinal decompression, particularly when other well-investigated, less expensive alternatives are available. So in other words, researchers from a chiropractic college are saying that you probably shouldn't use it. Likewise, most clinical practice guidelines don't advise the use of traction or decompression therapy for lower back pain because it's just not effective when compared to other treatments or to controls. But sometimes it does feel good. It gives a little bit of short relief, and so it's really easy for people to sell it to people who are suffering and in pain. So if you are suffering from pain, stretching your spine, taking some pressure off the discs can often feel really good, but it's probably not going to solve your problem in the long term. Now, likewise, you've got this thing called gravity that's pressing down on you all day long. And so it feels great when you lay down and take some pressure off your spine, and even more so when you get your spine stretched out. But as soon as that treatment's over and you go to stand back up, gravity loads back down on you and pretty shortly the symptoms are back. In fact, sometimes there's something called a rebound phenomenon that can happen after spinal decompression therapy, where you stand back up, you reload the discs and the nerves, and you get a sudden increase in symptoms. And so if you're looking to avoid spending a lot of money on a treatment that's not going to give you really much long-term relief, then there are a couple alternatives. Again, spinal decompression feels good in the short term, but you have to do it often if you want to maintain the effects. And so having some ways that you can do it on your own at home are much, much more cost effective for sure, and more effective in the long term, because you don't have to go somewhere and shell out money every time you want to decompress your spine. So one really great way to do that is just to lean over a desk or hold on to a doorknob or other stationary object, where you're opening up the spaces in your back just by bending over. You're taking gravity off because gravity presses down this way. And when you put your spine horizontal, gravity is no longer compressing your spine. Then you hold on and you just kind of lean back like this, holding on to the stationary object. And it gives you a little bit of a stretch in your spine. Again, you can do that on a desk. You can do that hanging on to a doorknob. You can actually hang on to the top of the door frame and just bend your knees a little bit and let it stretch you out like that. All of those are great forms of spinal decompression that you can do on demand with very little equipment anytime you want. And so, in my opinion, those are much more effective and certainly more cost-effective treatments or forms of spinal decompression therapy than going somewhere and getting stretched on a traction table. Now, if you do want something that you can use for spinal decompression therapy as you're going about your day, there are some braces that you can use that you put on and you pump them up. This is one example. It's called the DDS 300. And you just put it around your waist like you would with a normal back brace. Kind of strap it on like that and like that. And then as compared to a normal back brace that just compresses everything together, you clip this on. There's a little valve here. And then you pump up the brace, and the little air columns inside this brace, they start to expand. As you fill them with air, they stretch you up vertically. And so they actually give you a little bit of a traction or a decompression effect that decompresses you while gravity is compressing you. And so that does allow you to walk around and move around with less discomfort and with less compression on your spine. Now, does it fix anything? No, absolutely not. But it does allow you to go about your day, wash dishes, go to the store, go do things with your kids, your grandkids, or friends, and not suffer quite so much. So while it doesn't actually fix the problem, it can improve your quality of life. And I'll put a link in the description where you can get one of these. For full disclosure, it is an affiliate link, and I do have a discount code where you can save 10% if this is something that you're interested in. But overall, I think the best forms of spinal decompression are things that you can do on your own, where you don't need equipment, you don't need to go somewhere, you don't even need a brace. Again, stretching on a desk, hanging from a door frame, those are probably the best ways you can do it. If you need something portable that you can walk around and be a little more active, then a brace like this may be something that's helpful for you. So hopefully you did find this video helpful. Now, if you are in the St. Louis area and you'd like to find a more long-term solution to your problem, then we'd be happy to help you out here at More for Life. And no matter where you're watching this from, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.